good evening, everyone. Tonight we are going to talk about pet sheep and goats and think about some of the diseases that we see in these species, and many of them are quite different to what we might expect to see in production animals. So I thought we'd start with some of the main challenges as a veterinary surgeon of managing these patients, and I think one of them is that owners will often have minimal, or sometimes even more difficult, will have very skewed knowledge, particularly relating to vaccination and worming protocols, and many of them keep a reasonably large number of animals in quite a small space. Certainly in terms of goats, a relatively significant proportion of them are house pets, and some of those animals will be house trained, and that certainly depends on which part of the world that you live in. Some of the time that I spent out in the United States, more of the goats that presented with disease were house trained than weren't. I think the clients have reasonably high expectations, and some of them are insured, and there is one insurance company that will insure any type of animal, and Exotics Direct will insure sheep and goats along with a plethora of other things. And then the last one is we're often faced with an aged population. So we not only see very different diseases, but we're sometimes faced with animals that were never meant to get to 10 or 12 years of age, and we see those diseases manifest in that group. So in terms of management, we often see fairly poor vaccination compliance, and it's well accepted that both sheep and goats should be vaccinated with a 7-in-1 clostridial vaccine, sort of a preparation that's available from multiple companies. The other thing is endoparasite management. So lots of them feel that they'll have brought these animals in from various places, but they're going to be sterile, and magically they're not going to shed any form of endoparasite, and they're not going to keep reinfecting themselves. So they don't understand why they might need to look to see whether those animals need anthelmintics. And it still amazes me the number of animals that we will see that have liver fluke infestations, and I've written there in the right pasture, but actually the pastures don't really have to be that wet in order for us to see liver fluke. We've talked about land already, and then there's diet, and I am still astounded at the things that people feed to their goats. So lots of people seem to want to buy goats to graze paddocks and seem to forget the fact that goats are browsers, not grazers, and they will eat grass if there is absolutely nothing else, but they would much rather eat the hedgerows and probably the washing than the grass in these beautiful manicured paddocks that they've been placed in. And I think probably my favourite diet over the years was a lady, a very slender lady I might add, who brought in her very obese pygmy goat, and when asked what the goat ate, a large proportion of its diet was made up of white bread and ginger biscuits. And I obviously looked fairly astounded that this was its diet, and she said she didn't think that animals ate things that weren't good for them. So we had to have a little bit of re-education in terms of that animal's diet. And then the other thing is these animals, along with lots of other pet ruminants, are often obese. And I think it can be very challenging for clients to appreciate that, partly because of how difficult it can be to body condition score goats generally, and very difficult to body condition score sheep, especially when they have got a long hair coat. So as I've done with other webinars, I've just put together a sort of list of the common diseases of the pet sheep and goat that we will see. So diet, obesity, dental disease, endoparasites, foreign bodies in goats. Sheep generally are a little bit less inquisitive, acute abdomens, which we'll come and talk about, and then Johne's disease in goats. And clients can't appreciate that the goat has been infected as a kid with Mycobacterium paratuberculosis, but it may not manifest that disease until it's several years old, by which point it will have shedded an inordinate amount of Mycobacterium and probably had an impact on the rest of the herd or its offspring. We've obviously got ectoparasites, and we see fly strike, particularly in sheep. And then in terms of musculoskeletal disease, osteoarthritis in the old sheep and goat, overgrown feet, especially in animals that live in the house, fractures, sometimes just because of misadventure, other times in conjunction with their diet, laminitis, which we'll come on to talk about, and then in goats, caprine arthritis and encephalitis virus. Urolithiasis is a big one and is usually diet dependent. And again, in goats, we see pseudo-pregnancy in unspayed female goats very, very commonly. In terms of neurologic disease, cerebrocortical necrosis is certainly another big disease that we'll see. And then we've got the neoplasia, we've got tuberculosis in camelids, and occasionally we've got that in goats as well. And then we've got toxins, and we've got dog attacks. So I think that the difficulty when we're dealing with pet sheep and goats is when we think about the species that we treat on a regular basis, many of us pattern recognise in order to work out which body system and which disease process. And that's really hard if you don't see lots of sheep and goats. But also it becomes very difficult in the pet sheep and goat because they end up getting less common diseases anyway. And because of this, we need a problem-based approach. So thinking about having a logical sequence to approaching these animals, and remembering that the main differences between species is only two things: different physical exam findings and different differential diagnoses. But in fact, the procedures that we perform in these animals is exactly the same, it's just that their value varies. So in terms of an approach to these animals, starting with a thorough physical exam is always going to help you. My next approach will depend a little bit on what it is, but you can see from this list, these are all the same things that we would do in whatever species it might be that we treat on a regular basis, but it will vary a little as to how important they are. So in terms of physical exam in the sheep and goat, really important to body condition score them and explain to clients why you think their animals are thin or fat, because they're usually one or the other. And then doing a thorough examination of their wool, hair, skin. If we want to palpate peripheral pulses, femoral artery, just as you would do in the dog, and normal heart rate in a relaxed animal will be around 80 to 100 beats per minute. Sinus dysrhythmia is really very common and often very, very pronounced, especially in goats, and can sometimes trick you even when you're used to listening to it, because it is so pronounced. Rest rates can go up to about 28 beats per minute, and one of the big differences with sheep and goats is they sound like they're dying from respiratory disease, and that is that's what they sound like normally. Their respiratory sounds are very, very harsh over the entire hemithorax when you auscultate them. Normal temperature 38.5 to 39.5, and then rumen contractions a bit less important than they might be in terms of examining bovids, but it's going to be around 1 to 3 contractions per minute. Feces should be pelleted, and external abdominal palpation gives you very little information because of your rumen limit in sheep and goats. In terms of blood sampling, most people will blood sample from the jugular vein, and in sheep it's much, much more lateral than you expect. And if you don't blood sample a lot of sheep, it's definitely worth clipping them. In terms of catheterization, we can put catheters in their cephalic or their jugular veins, and again the cephalics are generally a lot more medial than you would expect compared to the dog. In terms of intramuscular injections, I will normally use longissimus muscles. You can inject cranial to the scapula, but be aware that goats seem to be very prone to injection site reactions, and that is obviously drug dependent, but they certainly can look like they're dying, and they get these sort of big lumps. So in show goats, it's worth thinking about whether intramuscular injections are appropriate.